Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. It's hard to believe, but we're celebrating our 10th anniversary of Health Matters radio program. We are planning some special shows to celebrate the milestone, and we hope you'll stay tuned. Excuse me. Let's begin today by thanking our sponsor, Studio Arts and Glass, and of course, our socially distant technical producer, JD DeAngelis. Joining me is Brad White, a compounding pharmacist, and our very special guest, Dr. Nicholas Roberts, Trauma Medical Director of Aultman Hospital and General Surgeon, Aultman General Surgery. Good morning, Doctor, and welcome to the show.
Good morning. Thank you both for having me on your show.
In the past, we've discussed the difference between urgent care centers and emergency rooms and what condition each treats. Today, we're going to discuss Trauma Center at Aultman Hospital. The emergency room, the emergency department of ER, is where people go when they need emergency assistance. That seems general, but ERs can handle anything from sprained ankles to heart attacks and strokes. They have the facilities, doctors, expertise to handle almost everything that comes their way. Trauma centers are usually located within the ER. They aren't often discussed singularly because they are part of the emergency room system. Trauma centers can handle extreme cases where there's an issue of immediate survival. Highly specialized surgeons work with the most advanced equipment to increase the likelihood of survival in the patients that are sent there. The word trauma best describes what brings people to those centers, as they are equipped to handle life-threatening and critical injuries. This morning, we're going to talk with Dr. Roberts about the Trauma Center at Aultman. We'd like to remind our listeners that our program is available also on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
So, Doctor, again, welcome to the show. I want to thank you for your service to the community during this pandemic. Tell us a little bit about yourself, your background, and your training.
Absolutely. So I'm from Dayton, Ohio, originally, actually a little suburb called Kettering. Kind of born and raised, went to the University of Dayton for my undergrad, followed by going straight to Wright State University School of Medicine for my medical school training, and then stuck around in Dayton through Wright State for my general surgery training. My family and I moved up to this area in 2012. My wife Amanda is originally from Hartville and went to Lake. So we kind of moved up here to be closer to her family. And I've been with Aultman since 2012.
So I guess you ended up here because of your wife. Is that correct?
Yes, pretty much. She wanted to come back closer, so that's why we ended up moving up here.
I see. So you came back up here from an NC, National Cash Register land.
That's right.
Interesting story about that. Years ago in the 1880s, the city fathers were looking for an industry to bring to Canton, Ohio. And so they had 3 people who bid to come here because the city was going to float bonds and that sort of thing from. National Cash Register was one of them. And Duberham and Watchworks was another, and there was a third one which I don't remember, but they decided that the cash registers won't last long. And so they didn't allow a cash register company to come, so they picked the watch company, the pocket watch company. So did they make the right decision?
Probably not.
So anyway, so you're not from originally this area, only your wife is.
Correct. I've been an Ohio native all my life, but no, we moved up here about 9 years ago.
Okay.
And been happy ever since.
Why did you decide to go into this branch of medicine?
Well, that's actually a great story. So I'm the first physician on both sides of my family. Most of my family members, including my father, are lawyers. But ever since remember wanting to do something, it was always to be a physician. Through my training, both in high school and college, I played sports and was active in sports, and worked as a student athletic trainer, both in high school and college. So my aspirations were actually become a sports medicine physician when I kind of went through training. As I kind of got into it, I really liked doing procedures and liked the surgical aspect of care, where a patient will come in with a certain ailment or injury, like an appendicitis. You take them to surgery, you remove the appendix, you give them a cure. I thought that was much more gratifying and satisfying than managing diabetes long term. So kind of fell into it through medical school, and then as we kind of did our training, I really liked surgery and doing those procedures, and was happy doing kind of bread and butter general surgery work. And actually, funny story, when I left residency, I actually joked with my wife. I was like, I don't care what I do or where I do it at. I just don't want to do trauma. And so then here I am now, the trauma medical director. So it's funny how God has a plan for you to do what you need to do.
Okay, that's interesting. Okay.
I love it. All right. So, what specialized training did you need to become a trauma surgeon?
So part of the general surgery residency, which is actually 5 years, we did trauma care throughout every stage of that. Usually involved where I did my training was at a level 1 trauma center down in Dayton, Ohio, Miami Valley Hospital. Additionally to that, you can do further fellowship training, and usually that's a 2-year course, doing both trauma and critical care medicine, where you specialize on just doing trauma management, trauma working. And usually people who do that tend to lean more to like level 1 trauma centers, bigger academic centers. So for myself, I really just did the 5 years of general surgery training and then additional training for trauma care outside of that.
Okay. So when did you become the trauma medical director at Allman Hospital?
Sure. So when I first started, I was actually on the trauma panel from the very beginning. So taking trauma call and managing those patients. Dr. Stephen Kelly, who was the trauma medical director at the time, and one of my partners asked me in 2016 if I wanted to step up into kind of a more administrative role. So I actually became the associate trauma medical director in 2016. And then he wanted to kind of leave and pursue other interests in 2017. And that's when I was officially named the trauma medical director. And I've been in that position since that time here at Allman.
Okay. So Allman Hospital is a level 2 trauma center. Can you tell the public what that means and what other levels of trauma centers there are?
So as far as accreditation for a trauma program, that comes through the American College of Surgeons. And they actually have 4 levels of trauma care, level 1, 2, 3, and 4. Level 1 is kind of the highest center, and we actually have 12 of those in the state of Ohio. The 2 closest to us would be at Akron General and in Summa. So level 1 trauma centers are kind of what you anticipate. They provide 24-hour, 7 days a week care and all the surgical specialties, in addition to some specialized care. What separates kind of a level 1 from a level 2 is that in addition to that services, they also do a research component where they're required to publish so many articles per year. They also have a minimum of maintaining at least 1,200 trauma patients per year in their registry, as well as doing some specialized care, like specialized cardiothoracic repair, specialized vascular, orthopedics, burn type injuries. So again, at Aultman, we are a level 2 trauma center. So we don't have the research component or the minimum number of patients to see, but we do provide 24-hour, 7 days a week care, both only in trauma surgery, but neurosurgery, orthopedics, and any of the subspecialties.
Okay. So you just mentioned some different types of injuries. What types of injuries are actually classified as being related to trauma?
So really the nuts and bolts of it, trauma injuries are any type of injury that's sort of a sudden and severe injury that requires immediate management and treatment, either at a trauma center or an emergency department to provide care. We kind of classify trauma injuries under 2 groups, both blunt or penetrating trauma. Penetrating trauma is what you would think, stabbings, gunshot wounds, impalements. Blunt injury is kind of everything else. So those are the falls from height, the car accidents, the assaults, but it also includes certain types of exposure injuries such as hypothermia, heat stroke, drownings, even hanging. So it is a very wide-ranging kind of group of injuries.
I can foresee, or I can see that sometimes it might be pandemonium in that area of the hospital. And what sort of training does the staff, you have other staff members for sure, but what sort of training do you folks have to say, okay, folks, we got 6 people here, it's time to get into action. You do this, you do that.
Sure.
What do you do?
So how we kind of manage patients and how we kind of work things up, it's all based under the training ATLS, which is produced through the American College of Surgeons, and that stands for Advanced Trauma Life Support. But it's a way for a medical provider, and it doesn't even have to be a trauma surgeon. It can be a physician, a nurse, EMS, that they can sit there and evaluate and manage a trauma type patient and then treat them appropriately or get them triaged to a center where they can be treated appropriately. It is somewhat organized chaos. And if anybody outside has kind of been into the trauma bay, when a trauma patient comes, it looks like there's probably 15 to 20 people all yelling and screaming and doing their certain things, but everyone really has their defined role. And we really try to work on that with the staff as far as educating them and training them on certain skills, making sure that when a trauma does hit, everybody knows their defined role and responsibility, or they're willing to help out or back up somebody to, again, provide the best level of care that we can.
Have you ever had a scene like MASH, the movie, TV program MASH?
Fortunately not. I mean, those are, and certainly in my training, we would get somewhat of a kind of a mass injury or mass casualty sort of situation where it'd be, like a van or a busload of people would be injured, or multiple shootings where you get 2 or 3 or 4 patients at once. And obviously you have to kind of divvy up your, your staff and your people to cover what you can, and obviously taking care of the sickest of the sick people first. Here, it's a little bit different. I mean, not that we don't have those mass casualties, and knock on wood, we don't, but through our kind of command center and through our EMS providers, we're able to kind of triage some of these patients. So if there is, like multiple injuries at a scene, we would get a patient or 2 patients. They would, ship another patient to another nearby trauma center. So that way it's not overloading one system. And again, people can get the care that they need.
How many patients would Alton see in a year in the trauma section?
So that's a great question. Typically, we see around 1,000 patients. I think over the last year, we had about, 1,065, which is a little bit up even through a pandemic year. Of those, obviously, not everyone gets admitted to the hospital, but pretty darn close. So we're very busy and very robust.
With the quantity of individuals that may be involved in a situation that classifies as a trauma patient, you have certainly multiple ambulances coming and going, but do you not sort those people, like go to Akron General or go to Mercy or go to whatever before they even get to your hospital? So
a lot of what happens is, there's discussions from the EMS, the people at the scene, even before they bring them into our facility. And so they call in kind of into our emergency department and talk to our command center, try to at least give them a list of what's going on, what's the injury to the patient, what they suspect, how the patient is doing from a physiologic standpoint, what their heart rate is, what their blood pressure is doing. And from there, we kind of triage, and we've got certain criteria that we look for to say, okay, does this patient need to come into our facility as a trauma alert, which is our highest level of activation? Can it come in as a standby, and we'll kind of work them up that way? Or is it something that would be better served at an outside facility? And so those conversations and those communications are going on even before the patient hits the trauma department. And obviously that's, best case scenario. We do have those patients that, get injured or get shot or fall at home and drive themselves. And so there are people that just kind of show in through the front door of the ER and need to be treated, and we have to deal with that. Obviously for me, being selfish, I like to get a little bit of an advance notice so I can kind of mentally prepare and make sure everything is ready to go when the patient does arrive. But unfortunately, this kind of nature of the business, you don't always get that.
So a burn victim, they go right to Akron?
So right now, if a patient were to get a burn, especially with the 4th of July coming up, or injure themselves like a firecracker, usually the patients will come to our center or another center to get at least stabilized and evaluated. Not all burn injuries require admission to a burn center. Certain things we look for, this total body surface area of the burn, where the burn's located at, in your face or genital region or hands. For us, the nearest burn center, it actually is at Akron Children's Hospital. Yeah. And then from there, Metro is also another burn center, depending on the age of the patient or the severity. So a lot of that will be handled here. If it's a pretty extensive burn and the patients are stable, they can certainly go to the burn area. But usually if they come into our facility, we can at least evaluate them, stabilize them, and then ship them where they need to be.
Okay. Time for our first break, Doctor. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I with Dr. Nicholas Roberts, Trauma Medical Director of Aultman Hospital and General Surgeon, Aultman General Surgery. So, Doctor, what is the most common trauma situation that you treat?
Sure. So, really, it kind of surprising that the biggest #1 trauma that we see at our facility is actually related to falls. almost 2/3 of all the injuries that we take care of are people who, either trip and fall from standing, falling down steps, even falling from height.
Jeez.
Especially with the weather and the ice. As our older patient population, even slipping on inclement weather, ice and snow can cause pretty devastating injuries. So about 2/3 of all our injuries are all related to falls.
And I've fallen enough times on the ice and the snow in my lifetime. Every time I get near ice or have okay, now let's think about the situation. Okay, you're gonna duck this ice, or you're gonna walk over it. So I can't even imagine in the winter months what it must be like, particularly with older folks. So, are there any types of injuries that you really don't take care of?
Well, as we said kind of earlier, there are certain injuries that are kind of better served at a specialized center. Here at Aultman, the big things that we kind of transfer out routinely, one would be pediatric patients. So anyone under the age of 18, we typically will evaluate them and stabilize them and work them up. But usually those children get sent over to Akron Children's, which I think is the most appropriate facility. Burns are also another one that we can manage small things, but some of the larger burns and more difficult airway issues are better served at a burn center. Others kind of specialized things include hand injuries. Usually we ship hand injuries up to Akron. Complex vascular injuries or thoracic injuries involving the aorta usually get shipped up. Outside of that, we routinely review and manage most everything else, with rare exception. And so I'm pretty happy with our staff that we have here, that we can really, outside of those little things, are equipped to manage most everything else.
We had a retired fireman working for us some years ago. I was talking to him about his fireman job, and he said the absolute worst thing was burn patients and having to deal with burn patients. And he said some of the things we saw were just horrible. And he didn't really mention any other issues, but that was the one he really talked a lot about. So I can't even imagine when you see one of those coming into the hospital.
Yeah, we had one in our training being in Dayton. They're famous for the Dayton Air Show, and we had one of the pilots unfortunately crash an airplane, and he came in with pretty much total body surface area burn. I mean, greater than 99%. He looked like he was thrown on a grill for a while, unfortunately, and he unfortunately didn't survive. But it's going to be absolutely devastating injuries.
Wow. Other than general surgery, what other medical specialists covered the trauma program?
Great question. So with us on our trauma panel, the big three specialties that we do work with are outside of the general surgeons, are neurosurgeons as well as the orthopedics. In addition to those, including maxillofacial surgeons, vascular surgery, plastic surgery, ENT, ophthalmology. As we kind of talked, the trauma injuries run the gamut of the whole body. And so really nowadays it's better to have the specialized care that you need for certain types of injuries. And so all of them do participate in our trauma panel and in our trauma coverage. Again, just to try to encompass any other injury that the patient may have.
What about heart attack patients? Does that fall in your realm?
So that falls under the jurisdiction of cardiology. And so we have our own separate heart team or stroke or STEMI team that will manage those. So that's different than what we would cover under trauma.
Okay.
Any other team members on the trauma team you want to mention? You just mentioned several specialties.
Sure. Well, and certainly, as the front line sort of people, the emergency department physicians and ED staff, I mean, they're right there with us in the trauma bay, evaluating and managing these patients. Anesthesia also helps out with difficult airways and certainly managing resuscitation on patients that we take to the operating room. Certainly we couldn't do what we do both in the trauma bay and the OR without their help as well.
Okay. So how is the trauma team activated? And do first responders communicate with the trauma team?
Yes. So as we talked about, the EMS are the ones that, they go out to the field, they're at the scene, they're evaluating those patients. They bring them in and communicate directly with our command center as far as, who they have, the age of the patient, the type of injury, and what's going on. From there, we've got a different triage algorithm that we use to activate a response. We have a trauma alert, which are the sickest of the sick patients, all the way down to kind of a standby, which is more just kind of the patient needs to be workup and evaluated, but they're otherwise stable. And then from there, that alerts, they send out notifications to the staff to either elicit the trauma response team to come down, or that just to kind of be in the waiting areas in case things were to deteriorate.
Well, I think we're very close to the news at the bottom of the hour. So you're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters. Just a quick reminder that Janssen's COVID vaccine is available for immunization at all of our Medicine Center pharmacies. I would like to give a shout out before we get back to the show to the MAPS Museum up next to the Canton Akron Airport. Their phone number is 330-896-6332. And these folks, these volunteers and employees have really done a wonderful job. They are having an event this Saturday night, with dinner at 5:30 and La Flavor for entertainment, tours of the hall, which is newly redone. So take some time and get up there and see the MAPS Museum. So Brad, I think you're up.
All right, doctor, when you're on trauma call, how quickly do you have to respond to an emergency?
So obviously, the sooner we can get there, the better. For our trauma alerts, which are our most highest level of activation, we actually have a 15-minute response time. So it could be having dinner with your family and you got to leave and go. Certainly during the winter months where the weather is inclement, sometimes it requires us staying overnight in the hospital just because we can't physically be there in the amount of time. But ideally, we try to be there within 15 minutes for alert patients. For the standbys and other ones that come in, obviously we try to see them as soon as we can, but there's less of that time stamp on it.
Okay.
Doctor, are there any educational programs provided by the trauma department?
Yes, we actually have an individual, Lori Patterson. She's our outreach and injury prevention coordinator. We do have several classes that we do provide. Obviously, with COVID, we've kind of switched from doing in-person classes to more virtual, and we're in the process of kind of going through those. Hopefully in the future, we'll be able to go back in person. The big three classes that we offer, one is called Matter of Balance. And this kind of is a nationally recognized program that works with kind of elderly individuals, and it kind of addresses the fear of falling. As we talked about earlier, falls are our number one injury that we see here. And so it kind of helps out with working on strength training and flexibility and balance. We also have the Think First program, which is dedicated more to the high school students and stressing the importance of kind of safe behavioral choices and using your mind to protect your body. We also offer the Stop the Bleed course, and the Stop the Bleed course is brought on by the American College of Surgeons as a way for civilian populations to respond and initially stop uncontrolled bleeding in emergency situations.
So what about any other educational programs? The ones, how do you do that? Do you do it at the hospital, or?
So certain times we perform them at the hospital. Other some of our sites we go to on-site visits. Lori Leonard, her number is 330-363-6186. If the listeners are interested in going to some of these classes, she is certainly a great resource and it can help people get set up. Like I said, with COVID and things like that, we've kind of put that on the back burner a little bit just to kind of work through some of the logistics of things. But hopefully soon we'll be back in full go and providing these classes to our population.
Any involvement by you in your section with COVID?
So we have had to deal with some COVID issues. Certainly, just like anything, trauma patients are not immune to COVID, and so early on, especially, we had to take special precautions, including wearing the N95 masks while we're in the emergency department. But we have also had patients that came in with a simple fall or a car accident that were diagnosed with COVID at the scene. So we have to take precautions with that, just like any other aspect of medical care. And so I just want to applaud our staff and applaud our physicians for doing such an admirable job through this pandemic.
Are you on social media?
So I'm not cool enough to have my own Twitter or Instagram account, but we can be found both on the web under altmandocs.com or altman.org, excuse me. Allman Hospital has its own Twitter account at Aultman Hospital. And there's also multiple Facebook pages, Aultman Medical Group, as well as Aultman Hospital, that do provide daily or weekly education and information regarding that.
I'm not sure about this question that's on the script. It says, how does a patient reach out to you to make an appointment? Is that to your practice, I suppose. Okay.
Yes. So obviously, you're never going to predict when you're going to fall and have an accident or an injury.
No.
So from that standpoint, no, it's not calling me ahead of time to let me know that you're going to get in a car accident later on this afternoon. But
Right.
as far as our office, we provide same day appointments through our office, which is located in the Aultman Physician Building right next to the hospital. We also have other centers out in Maslin and in Orville. But our number is 330-453-4300. And you can call. Again, we don't need necessarily a physician referral. If you have an issue like a hernia or something like that, we can also take care of it and do provide same day appointments if needed.
Okay.
I understand there are some other changes happening where you practice at Aultman General Surgery. Do you want to comment on those?
Sure. So we actually are looking into kind of expanding our reach. We are looking at setting up satellite offices both in Dover as well as up in the Hartsville area. My hope is maybe by end of summer, the satellite office in Dover will be up and running and staffed that way. Not that we'll be able to provide surgery at that facility or that area, but at least provide access to people south of Canton to see a surgeon and see us in the clinical setting. And if we do need to operate, certainly we will be doing it at Aultman. But again, just another way that we can provide a little bit better care and coverage without making our patients having to drive all the way into the city.
I missed are you building a facility down there? Or?
They're working on the facility is already built. It's just a matter of getting it staffed and getting kind of the wallpaper up and the things like that. So hopefully by the end of summer, we'll have everything ready to go.
No, where is that exactly?
It's down in Dover is where the initial facility is going to be. Again, I don't have the exact address off the top of my head, but like I said, I'm sure as we get closer to it, just on the social media stuff, we'll be promoting it and probably having an open house once we do get that up and running.
Sure.
Are you adding staff members there too?
We are. So we're bringing in a new surgeon, Dr. Chase Beach. He'll be starting with us in August. He'll be a recent graduate of residency. So we're happy to have him and hopefully bring his expertise and his skill level to our community to help everything out.
So how do you manage being both general surgeon and a medical director of a trauma center? Sounds like you're a busy guy.
I am busy, but it's a good busy. And certainly in our business, it's better to be busy than sitting there twiddling your thumbs. Certainly my wife will tell me I will do better when I'm busy than when I'm bored sitting around the house. With being a general surgeon, you kind of do everything. I mean, you do hernias and cancer operations, big belly cases, even little, cysts and lumps on the skin. And the same thing kind of applies to trauma. So it is kind of nice that every day is a little bit different and you never know kind of what you're going to get. And that way you're not doing the same thing day in, day out, because that can certainly get monotonous. We do share call with several of my partners as far as trauma calls. So even though I am the director, I'm not covering the ER and the trauma every single day of the week, but we each kind of get our turn. So it is kind of nice to kind of break things up a little bit and kind of share that burden with my fellow partners.
Very good. Is there a recurring accidental trauma that might surprise our listeners that you'd like to bring the attention to in hopes of maybe preventing?
Yeah, so I mean, obviously not all injuries are preventable. I mean, that's why they're called accidents, and no one has the best laid plans of I'm going to get in my car today and get in a car accident. I think again the biggest one that's kind of surprising is falls. And certainly falls even from a standing height can be pretty devastating. And certainly as our patient population is getting older, there's more medical issues. Patients are also on blood thinning medication for a variety of different reasons, be it heart disease or something like that. And so even a very minor fall, even like a fall on your bottom, can cause hip fractures in patients who have osteoporosis or osteopenia. Striking the head, even though a minimal injury with being on these blood thinnings can cause a devastating brain bleed. So I think it's just really kind of important for those that are living independently, that are older, that our family members kind of check in on them, making sure they're doing okay. I mean, it's never a great thing to have to say that you can't take care of your parents or your loved ones or family members, but sometimes you kind of have to take a step back and realize what's best for them. And if it means putting them in an assisted living center or providing some care, obviously not everyone can do that, but that certainly would be helpful. Outside of that, like I said, you can plan to do the best course of action and things happen. So that's kind of the hard part is, good things do happen or bad things happen to good people. And again, as much as you try to prepare and plan, sometimes these things do happen and it's completely no fault of anybody involved.
As we get older, okay, we tell ourselves that I can do that.
Sure.
I can still do that. I did this all my life, and okay, I'm 70 some years old, and I can still do that. I can still cut the tree down. And, I'm thinking, yeah, how many of these people do you get in the hospital? Well, I was just trying to cut the tree down. I've done it before. you know.
Sure, and it's surprising. I mean, it runs the whole gamut from a broken arm or a cut or a scratch all the way to a lethal injury. And it's something even simple as putting up Christmas lights in the winter and
Yeah,
falling off the ladder, depending on how you hit or where you hit, can be a devastating injury.
sure.
So that's always kind of that frustrating part is being able to, have this sort of thing and then kind of move on from it and recover. Not only does it potentially could be life threatening, but it could be devastating injuries. A broken joint or a broken, bone can have repercussions for months, even years down the road.
Yeah, and I kind of want to echo to your fall risk. When we talk to patients in the pharmacy, I don't think some people realize that sometimes their medications can have an effect on their balance or their ability to navigate. Just something as simple as stairs or around furniture. So have heart that just because if you have a fall, don't write that off as being normal. If you find yourself maybe feeling like you're a little more clumsy than you used to be, please talk to your doctor, your pharmacist. Reevaluate your space to make sure you don't have throw rugs that could jump up and grab you when you're not expecting it. It certainly is one of those things that unfortunately we hear a lot about in the pharmacy, where people just think it's common as they age to fall down more, and it's something that could be very dangerous. So
Welcome back to Health Matters with the Medicine Center Pharmacy. Today we are talking with Dr. Nicholas Roberts from Aultman Hospital. I'd like to jump back a little bit to Tuscarawas County project. What all will you be able to do down there?
So for right now, really the only opportunities that we'll be able to do is provide initial evaluation and management, very basic things like abscesses or skin sort of things we can take care of. But right now we won't have the capabilities to perform any surgeries down there yet. Everything will still kind of have to come back up to Aultman's main campus. But at least it gives an opportunity, rather than making multiple long trips to come and see us, we can see patients in their own neighborhood and in their community. And if need be, and they need surgical intervention, can do that here at the hospital. And then the nice thing is having their further follow-up be down again, back in their own community.
So is it Altman's intention to have a bigger facility down there as it goes forward?
Not that I'm aware of, and unfortunately, maybe in a perfect world, having some capabilities and some things down there. Obviously, the state of medicine in the state is kind of in flux a little bit with bigger kind of hospital conglomerates. I think it's more just to kind of get our foot in the door and provide the best level of care to our patients that we can. I don't foresee them building a brand new surgery center down there or another hospital down in that area. I don't necessarily think that that's what the community needs. But hopefully, again, if we can provide early access and ease of access to our patients, I think that's really the ultimate goal.
Now, will you have any involvement in the new cancer center?
So from a general surgery side, yes. I will be able to take care of our cancer patients, our breast cancer patients, and colon cancer patients. They are, as you know, in the process of building the brand new cancer center currently. I don't know when the ultimate deadline is or when the opening date's going to be, but we will have some involvement with that. I don't think it's going to be surgery at that center. Again, it'll just be across the street at the main hospital, but we will certainly be involved with managing those patients.
And what I hear about that center is that it'll be a total center for cancer only, patients only.
Correct. So this will be an area where both from a surgical side of things, as well as a medical oncology and radiation oncology, they would have their infusion center there. So if a patient were to come in from the very beginning diagnosis all the way through the very end of treatment, it would be at that area. And again, they'd be able to provide the complete scope and focus of cancer treatment at that facility.
So it'll have their own beds, et cetera, et cetera. Is that?
Yeah, so it won't necessarily be like an inpatient center. They will have their own office space. an infusion area for radiation treatments. They'll be able to receive those there. Anything that's going to require kind of in-hospital management will have to be done at, obviously, at the main hospital, but outpatient issues and things like that will all be done at that cancer center.
Okay. Go ahead,
So,
Brad.
given your role as a general surgeon, how has technology helped you perform your job more efficiently or for better outcomes for patients? Do you have any favorite tools, tips, techniques, technologies that you're fond of?
Yeah, so technology certainly does encompass everything that we do, and even in the OR, we're using now the Da Vinci robot, which I think we've talked about in prior episodes. That's kind of the new thing in general surgery. It's a way that we can use a robot to operate on patients, provide minimally invasive surgery for a variety of different procedures, with the expectation they'd have smaller incisions, less pain, quicker return to activity. And that's really kind of changed how we do things, certainly from a hernia standpoint, but also dealing with gallbladders, doing foregut procedures, even colon cancer operations. And that's been really exciting to kind of hit the ground running with that and really embrace it and moving forward, again, to provide our patients with the best level of care and the newest technology and treatment methods.
It's amazing how technology has kind of intertwined itself with all of our different disciplines, from pharmacy to medical to surgery. So it's anything that helps the patient recover faster is certainly a benefit.
Absolutely.
Anything on the horizon you're looking forward to with future trends in trauma care or general surgery?
So as far as like kind of the future trends, obviously it's providing quick access and quick treatment to patients. It is going to be somewhat interesting here with the summer. Obviously, that's kind of our busier months, and kind of coming back from a pandemic. Obviously, this is nothing that we've ever gone through before. It was a little bit slower during the summer last year. I fully expect things to be a little bit busier here this summer, just as more people are out and about and doing more things. So we'll kind of have to kind of see. Obviously, we're just trying to kind of do what's best for our patients, provide the best care at 24/7 access.
Any message you'd like to leave with our listeners today?
Sure. So first and foremost, before we go, I need to give a shout out to my children, Liam and Violet. Thank you so much for everything, and you guys are great. I would just say to our listeners out there, especially with the 4th of July coming up and like I said, the summer months, just be smart about things. Obviously, you can't prevent an accident, but if you're wearing your seatbelt and not driving or operating machinery while impaired, you'd be surprised just how fortunate you may be if an accident does occur. Like even wearing a helmet while you're riding a motorcycle can really prevent or at least decrease the chance of severity with injuries. I wish there was a magic pill or something we could do to prevent these from happening, but we unfortunately can't. But it's a matter of just doing what's safe to hopefully prevent a small injury become a catastrophic one.
Very interesting.
How about sharing your website again and contact info with the listeners?
Sure, absolutely. So I can be reached at our office. The number is 330-453-4300. We're also on Twitter at Aultman Hospital. The website is either altmandocs.com or altman.org. And then there's 2 Facebook pages, Aultman Hospital and Aultman Medical Group, that do provide information.
Very good.
Okay. Thanks for coming by today, Doctor.
Thank you so much, Paul and Brad, for having me. I appreciate it.
Dr.
Thank you.
Nicholas Roberts, Trauma Medical Director of Aultman Hospital and General Surgeon, Aultman General Surgery. We'd like to remind our listeners, if you suspect you have a medical issue, please call your healthcare provider. And thanks to Studio Arts and Glass, of course, our technical producer, JD DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. We'll see you next week right here on News Talk 1480 WHBC, and have a healthy week.